Scapula is a wide, flat, triangular bone which overlies the 2nd to the 7th ribs on the posterolateral thorax. It has a dorsal as well as a costal surface. We can see that there's an upper border with a superior angle, a medial border which extends all the way down to the lower border, inferior angle, and a lateral border. There are 3 bony prominences. Projecting from the dorsal surface, we can see the spine of the scapula. This extends all the way to the acromion, which projects forwards at 90 degrees from the spine. And then we can see the coracoid process, which projects forwards and slightly laterally. Spine which projects dorsally. This separates the infraspinous fossa from the supraspinous fossa. The supraspinous fossa is the origin of the supraspinatus muscle, and this is smaller than the infraspinous fossa, which is the origin of the infraspinatus. And these fossa communicate on the free lateral edge of the spine of the scapula at the spinoglenoid notch. On the sharp superior border, we can see that the suprascapular notch anterolaterally separates the root of the coracoid, which projects anteriorly as well as laterally. As we come up towards the superior part of the lateral border, we can see we have the glenoid fossa. This is oval, shallow, and retroverted by 5 to 7 degrees from the scapular plane, and this is deepened by fibrocartilage, a fibrocartilaginous glenoid labrum. From the supraglenoid tubercle is the origin of the long head of the biceps. The infraglenoid tubercle is the origin of the long head of the triceps. Lateral border, which is much thicker in comparison to the thinner bone of the body of the scapula, are the attachments of the teres minor, coming down to the teres major muscle, and the latissimus dorsi, which is from the inferior angle. Along the medial border, on the dorsal side, is the levator scapula, rhomboid minor and major, and on the costal side is the serratus anterior, which originates from the 1st to the 8th ribs. We can see on the inner subscapular surface there are about 3 or 4 ridges, and these represent attachments of the fibrous septa of the multipennate subscapularis muscle. Similarly, on the lateral side of the acromion there are about 3 or 4 vertical septa, which are the represent the fibrous attachments of the multipennate deltoid, and this has a continuous attachment all the way up to the deltoid tubercle on the lower border of the spine of the scapula. The upper surface along the spine of the scapula is the attachment of the trapezius.